Hey guys, today I'm going to talk to you a little bit about general anesthesia as it pertains to the surgical patient. So, what exactly is general anesthesia? So, basically, it's going to be a combination of medications that are given to the surgical patient so that they can tolerate a procedure. These medications together produce an unconscious state in the patient, also amnesia or not being able to remember, analgesia, which is no pain, muscle relaxation if they are given a muscle relaxant, and respiratory depression. So, obviously, with respiratory depression, the patient will need to be intubated and connected to a ventilator. So, guys, check out our lesson specifically on intubation in the OR. So, with general anesthesia, we have three different phases. Induction is when the medications are given to the patient and the patient goes off to sleep. With maintenance, the medications are continued to be given to keep them asleep. And emergence is going to be when the patient is given medications to reverse the anesthesia or the anesthesia medications wear off and the patient wakes up. So, what are some common medications that are used with general anesthesia? So, propofol is one that I think that most people are pretty familiar with. It's a non-barbiturate intravenous anesthetic that looks milky. Sometimes inhalation agents are used, and sometimes they're not. But if they are, sevoflurane is one of them. The facility where I work, we use all intravenous medications and no gas. It enables patients to wake up faster and not have excess side effects that sometimes can be created from these inhalation agents. So, moving on, some opioids are often used for the pain component of surgery. Medications like morphine and fentanyl. And if a muscle relaxant is used, succinylcholine, or they call it SUX for short, is a common one. So during anesthesia, the patient is going to be monitored continuously by the anesthesia team. Things like vital signs, oxygen saturation, EKG, capnography, which is the measuring of the CO2 levels of the patient, will all be monitored. So I think it's pretty important to mention that one of the tools used by anesthesia is the ASA Physical Status Classification System. So this was developed by the American Society of Anesthesiologists, and it grades the patient's overall health or their risk before anesthesia and surgery. So here we have a little chart that will show you the different classes in the ASA Physical Status Classification System. The levels are going to be from 1 through 6. ASA 1 is going to be a normal, healthy patient, all the way up to ASA 6, where the patient is considered brain dead and their organs are being harvested for donation. So besides general anesthesia, there are other anesthesia options for a surgical patient. So considerations to the anesthesia type can be based on the patient's comorbidities and mental health status, a patient's postoperative recovery concerns. So, for instance, if your patient comes in and they're expecting to drive themselves home, this would be something to consider. So, obviously, driving immediately after general anesthesia is not allowed or safe. So, the patient might opt for a different kind of anesthesia, like local anesthesia instead. So, guys, make sure you check out the additional lessons we have on local anesthesia and moderate sedation for more information. Okay, guys, it's important to review some of the side effects that we see with general anesthesia. Each patient acts very differently. Some have no side effects at all, and some have nausea and vomiting, or shivering, and sleepiness is pretty common. Sore throat and hoarseness typically have to do with the endotracheal tube that's needed during general anesthesia. Okay, let's review some of the nursing considerations with general anesthesia. It's important to recognize that the elderly and patients with chronic conditions are going to be at a greater risk of complications associated with anesthesia, including pneumonia, confusion, stroke, and cardiac issues. So additionally, pre-existing conditions like a seizure disorder, also smoking, obstructive sleep apnea, and alcohol and drug abuse can all increase the risk of complications. Also, patients that have chronic renal, hepatic, cardiac, respiratory conditions, they're all also at an increased risk postoperatively. A super important consideration is a history of anesthesia issues that the patient or the patient's family might have, like malignant hyperthermia. Guys, malignant hyperthermia is an extremely serious, potentially life-threatening condition that is associated with general anesthesia. So make sure you check out the lesson all about malignant hyperthermia. So the patient should have a complete overall health status assessment, pre-procedure vital signs, and planning of the patient's needs before, during, and after anesthesia. So go check out the specific lessons we have on the preoperative nursing priorities and preoperative nursing assessment. So what happens after anesthesia? So typically the surgical patient who has received general anesthesia will wake up or be recovered in the post-anesthesia care unit or PACU. Sometimes the patient will also be recovered in the intensive care unit or in the ICU. In order for the patient to be discharged, they must meet certain criteria. So make sure you check out the lesson on post-anesthesia recovery. Okay, so what should we teach the patient? It's important to teach the patient what they can expect before, during, and after anesthesia. In my experiences as a perioperative nurse, patients are the most concerned that they will not wake up. So talking to them about the process helps to ease their anxiety. Also, it's important that patients know how critical it is to follow instructions like being NPO before anesthesia and not driving after anesthesia. And as always, they should be encouraged to ask questions. So when we think of the different nursing concepts related to general anesthesia, comfort and patient-centered care come to mind, as anesthesia enables a patient to undergo surgery in an unconscious state. And let's be honest, who wants to be aware of someone physically removing their gallbladder? Not me. So of course, patient safety is paramount and the reason we assess our surgical patients who will receive general anesthesia preoperatively. Okay, some key points to take with you. General anesthesia includes giving a combination of medications to the surgical patient that produces an unconscious state without memory and pain, relaxation of muscles, and respiratory depression. Common medications include propofol, morphine, succinylcholine. Side effects can include dry mouth, nausea and vomiting, shivering, and sleepiness. As perioperative nurses, we will assess the patient's overall health, vital signs, conditions that increase their risk of complications, and their needs after anesthesia. Finally, we will teach our patients what to expect with general anesthesia, the importance of following instructions, and encouraging them to ask questions. Okay, guys, I hope you enjoyed this lesson on general anesthesia. Make sure you check out all the resources attached to this lesson, as well as the rest of the lessons in this course. Now, go out and be your best self today, and as always, happy nursing.